video is intended for faculty purposes only and based on the eVolve performance checklist skills. Certain equipment or steps may have been omitted. Suctioning. Step 1, assessment. Identify patient using 2 identifiers. Assess for signs and symptoms of airway obstruction requiring suctioning. Assess symptoms associated with hypoxia and hypercapnia. Assess for risk factors for airway obstruction, including pulmonary disease, level of consciousness, fluid balance, humidity, gag reflex, and anatomy. Identify contraindications to tracheal suctioning. Obtain sputum microbiology data, if necessary, and assess patient's understanding of procedure. Step 2, planning. Explain procedure to patient. Encourage patient to cough out secretions. Explain importance of coughing during procedure. Assist patient into appropriate position. Place pulse oximeter on patient's finger. Observe reading and leave pulse oximeter in place. Place towel over patient's chest. Step 3, implementation. Perform hand hygiene and apply PPE if necessary. Your next step will include connecting the tubing to the suction machine. Place other end near patient. Turn on the device and set negative pressure appropriately. You will also connect your patient's ambu bag and place it near the patient. Following this, you will increase the supplemental oxygen supply if indicated. Encourage your patient to breathe deeply. Remove gloves and perform hand hygiene. Now we may begin the suctioning process. Open the saline bottle, lift the bottle, and then place back on table. Open suction kit. Apply the sterile gloves. Remove the box from the kit and place on table. At this time, you want to designate your clean hand and use it to pour the saline into the box. You will then pick up your suction catheter and secure it to your suction tubing. You will now lubricate the suction catheter by dipping it into the saline and test the suctioning at this time. You will now check the patient's SpO2. Hyperinflate or hyperoxygenate patient before suctioning. After doing so, you will insert the catheter appropriately until resistance is met. Once resistance is met, pull back 1 centimeter and apply intermittent suction appropriately. Watch for any signs of respiratory distress. After your patient's secretions have been cleared, replace the oxygen delivery device. Encourage the patient to breathe deeply, and rinse catheter and tubing until clear. Assess patient's cardiopulmonary status for clearance and complications. Repeat steps to clear any other secretions. Allow adequate time between passes, and do not perform more than 2 passes with the catheter. Perform tracheal suction again if necessary. To complete your procedure, disconnect the catheter. Roll catheter around fingers. Pull off gloves so catheter remains inside, and discard appropriately. Perform hand hygiene and turn off suction. Remove towel and place in laundry. And after doing so, reposition patient and make the patient comfortable. You have now completed trach suctioning.